You are listening to the Horse Radio Network, part of the Equine Network family.
What a beautiful day for horses in the morning.
You are listening to the #1 horse podcast in the world. Here is your entertaining look at the horse world and the people in it.
This is Ashley Winch in Albuquerque, New Mexico.
And I'm Kat Gunther from White Lake, Michigan. You're listening to the Quarter Horse Podcast for Tuesday, May 20th. Good morning, Horse World.
You're listening to the Quarter Horse Podcast, where we explore the versatility of the world's most popular breed of horse, the American Quarter Horse.
So on the last episode, we focused on quarter horses from nose to tail. We thought we would focus on horses inside out today. Are you excited, Ashley?
I'm so excited. I love it.
Me too. So we're joined by Katrina Johnson, a licensed veterinary technician specializing in equine dentistry, to talk about, mouth, teeth, all that. And then veterinarian Doc Yardley will be joining us to just talk about overall health.
I love it. I love that we're kind of focusing again on the quarter horse holistically. I learned so much from our last episode, talking about the body work and the feet of the quarter horse. And so now to be talking about everything from the other way, it's just so exciting. And I know that you have a very unique connection to our first guest. So tell us about how you know Katrina.
So besides us having the same name, because my full name's Katrina, not Kat, but we used to show quarter horses together. We showed on the Michigan Quarter Horse Circuit at the same time. And she's actually worked on my mini horse. She's been to my house and worked on my mini horse and floated his teeth. So I've known her for a little bit, and she's great.
We love when a podcast story comes from real life. All the time we're really talking to strangers, and we pitch them, and we're just like, hi, please talk to us. So this is always fun when you can have a friendly voice on the show. It just makes things a bit more exciting. And I know you guys are going to love the interview. We have a particularly unique, funny story for you guys. So buckle up and get ready for that interview.
I think it's the best one yet that we've gotten from asking people what their funny stories are.
I think it goes down in the Hall of Fame of Horses in the Morning. You guys tell us, but I think this might be a top 3 for sure.
Yes, I agree. And Ashley, what about you? Have you ever had experiences specifically with your quarter horse's health or dentistry?
My quarter horses have always been pretty low key. I've been lucky. They've been low maintenance. I mean, my dressage, do it all guy, Boo, he got some hock injections towards the end of his career. My other quarter horse, his name was Buzz. He had a bit of a club foot moment. So, we did do a lot of natural, not shoeing because he was barefoot, but trimming. And that corrected his club foot. It was a very minor club foot, but I've been really lucky. I know not all horses are easy keeper. What about you?
Teddy was a lot. So I got him when he was 18, and we did the hock injections. There was something that was you take the blood out of them and then put it into the injection.
Oh, like a PRP really kind of thing?
Yes.
Yeah.
So we did that with him just to keep him going because he was already older, and 18 in show horse years was grandpa status. So, yeah, I'm used to, having the issue, a little bit of health issues with the quarter horses, but I mean, it's just hard to balance them because you forget that they're this huge animal that needs the same medical attention that a person would need, if not more, because they're huge.
And, when we go to the doctor, we can say, hey, doc, my foot hurts, my throat hurts, my shoulder's out of whack. They can't say a thing. And so we have to, go in with a team, chiropractor, vet, farrier, dentist. I mean, however many other acupuncture. I mean, I've done a lot of it.
Yep.
And it does take a team to keep these animals, first and foremost comfortable so that when we show up for a ride, they're smiling and happy. And then we can all start from a great spot,
Yeah, 100%. It's funny you mention all that because I will push off going to the doctor for myself. But if my horse is looking at me funny, if he gives me that look of I'm uncomfy, I'm like, the vet's coming out for you right now.
I would guarantee that is a majority of our listeners as well.
Oh, yeah. Oh yeah, because Aspen, my gypsy vanner, he has heaves, right? And
Yep.
one time, a lady at the barn called me and she's like, he's coughing a lot. He's laying down. He literally was just taking a nap and coughing a little bit, but I had the vet come out. The $200, $300 farm call because I'm like, he's having an asthma attack. Get his inhaler out. Like, he has an emergency inhaler. So,
Oh my God, I love this so much. He's just like, oh, sweet, more treats for me. Thanks, Mom.
oh, and they love him. That's the thing too, is that he knows that the techs are gonna come give him treats. So
oh my gosh,
it's on purpose.
I think he kind of knows the game now. Kat, you got to be careful. These guys are too smart.
He has my number. He knows I'm a sucker for him.
Well, without further ado, let's welcome Katrina to the show. Joining us today is Katrina Johnson, who's a licensed veterinary technician specializing in equine dentistry in Hanover, Michigan. She also travels throughout the Midwest, Michigan, Ohio, Indiana, and even Texas twice a year. Katrina, thank you so much for joining us today on the Quarter Horse podcast. You know I have to get started with hearing about your quarter horse background.
Thank you for having me. I really think this is pretty awesome. So I grew up showing horses and typical 4-H start, ventured into the open shows, and then progressed into the quarter horse industry. From there, I really have taken a liking to the breeding aspect of the quarter horse show horses and bred quarter horse show horses for roughly 4.5, 5 years. And then I have young kids, so stepped out for a little bit. So I just currently have one little Best Martini filly and absolutely love her. So I will get back in the pen eventually, one day.
Happens to the best of us. I mean it. What kind of discipline were you breeding for?
Western pleasure mainly, Western all-around. I didn't go into the all-around too much just because that kind of petered out in the industry a little bit. But I feel like it's coming back. I see a good, strong pull for it.
Just a fun little thing to put in here. Me and Katrina showed the Michigan Quarter Horse Circuit. I feel around the same time back in the day because I remember we have the same name. Yeah, I was like, oh, there's another Katrina out there.
Yes. And so do you remember my big mare Coco, the big red?
I do. Yes.
And then you had your red gelding. It was 2 peas in a pod.
Yep. I had Rowdy back then. Yep.
I love it. Okay, so we love quarter horses. We did some breeding. We did some expositions. And then at some point in your story, you got involved in their mouths. Tell us about your journey there to becoming, having your specialty in equine dentistry.
So I've always had horses growing up and went with my mom to all of their veterinary appointments. Especially the equine dental appointments. We went to Oakdale Large Animal Clinic pretty consistently, and Greg Vanderwall was my dentist for all of my horses growing up, and I was just absolutely infatuated with it. I knew I wanted to work in vet med, and I didn't want to just be umbrella, do it all. I really wanted to specialize, and having the interest in the dentistry that I did, I started venturing out looking for schools, and I actually landed in Texas for my equine dentistry education. So I got my LVT license here in Michigan and my equine dental education down in Texas.
Wow. So do you see anything specific in quarter horses in their mouth that you don't see in other breeds?
Not necessarily any abnormal developments in quarter horses specifically, but I do find with quarter horses, they require such a balanced mouth to do their job appropriately because we can have a whole lot of issues arise from a small imbalance. So biannual or annual dental exams are extremely important for the quarter horse show horse because we expect so much out of them. We expect them to be in such a frame that if they have an imbalance, even if it's minor, can greatly impact their performance.
So when you talk about a balance in the mouth, could you explain that in a way, since we're an audio, format, it's hard. Could you help us to visualize what you mean by balance in the mouth?
Absolutely. So horses have molar arcades. So we have, let me think about how we can best visualize this. I'm very working with a specimen at the time. So we have a nice balanced road. So from the back of the mouth to the front of the mouth, we have to have all of our molars the same crown height. Each individual tooth has to maintain a 15-degree roughly table angle. And we have to have 3-point balance from their TMJ, their molar arcade, and their incisors. Everything has to work simultaneously because as the horse is performing, they have a nuchal ligament, which is running between their ears all the way down to the top of their tail dock. And we expect them to round out for lope departures, self-carriage in your jog, all sorts of things. So having a nice balanced mouth is going to be imperative for them to lift and hold comfortably and consistently. So not having a tooth that's over tall, overgrown on one side of the mouth, making them cock their head or experience too much pressure on that TMJ and cause them all sorts of fight in that response.
So do you ever think trainers or riders might mistaken riding issues or behavior issues for just pain in the mouth? Because I feel like I've heard that happen a lot.
Absolutely. Still to this day, there's a lot of, there's just not enough education on equine dentistry and the horsemen. There's a lot of horses that get passed around for behavioral issues, whether it be because we have a hidden wolf tooth, a blind wolf tooth. We have protuberancies that we're dealing with fractured molars. I actually just had a case recently that the horse was dropping weight. I just seen it in October. The horse was dropping weight. The horse went to a new owner, mind you. So it was under somebody else's care from October until I think they got him back in January. And he was just doing very poor. Well, it turned out this horse was experiencing such discomfort from 2 fractured molars that he was dropping weight like crazy and he wasn't able to perform and do his job at his usual. He was an absolute amazing competitor and just trashed his record because he was so uncomfortable.
Wow. So what are some signs people can look out for in the mouth?
Excessive salivation, head tossing, gaping at the mouth while you're trying to get in contact to set them up in a frame. Head tilting, obviously the obvious with the grain spill and the quitting of the hay, but a lot of your fight response when it comes to training on a horse could possibly be a dental issue.
That just breaks my heart to hear. And I know, in different degrees, we've all been guilty of something like that happening because
for sure.
At some, you don't know what you don't know. And as we all understand, these animals can't tell us. And so we have a joke here on Horses in the Morning where everything's an ulcer. Oh, if the horse is acting funny, check for ulcers. The horse, isn't eating, check for ulcers. But honestly, it sounds like we should be checking teeth too.
Absolutely. I like to, for the performance animal, especially quarter horses, all performance breeds, they need to be checked biannually because, for example, Kat knows my Coco show mare that I used to show. She loved her 6-month dental checkup because any slight enamel fold that developed into a sharp point, that girl was like hot on it. She would tell me every single time, like, oh, I got a pain. I can't work today. And she would just change immediately after balancing her mouth out. And it could be something so simple developed, but they want to feel their best so they can do their best. I 100% believe that horses are not intentional brats. There's typically a reason why. It's not necessarily always a dental issue. It could be something else, but that's why it takes a team. Farrier, vet, dentist, chiropractor. It takes a team to take care of these fine animals.
Hey, if my mouth is hurting, I'm a brat. So I don't blame a horse because I've had root canals and they're very, anything in the mouth is super painful.
It is. And I tell you what, as an equine dentist, it is such a rewarding job to, for example, I was working on this one horse and it kept rearing up on this little girl. It was just a 4-H type show horse and they just got it rearing up. Every time she made contact with the bit, turns out it still had wolf teeth and it was an 8-year-old or something, middle-aged, and pulled the wolf teeth and the horse completely turned around for that little rider. And still to this day, she has that horse. So it matters that the horse is well taken care of in all aspects. They're stoic animals. They're not going to tell you they hurt until it's like past their breaking point. The threshold has been broken.
So let's talk a little bit about teeth and what we can expect from a growing horse. You know, it's full season out there. I don't know about your guys' feeds, but mine are all full of fillies and colts, and I just want to scream because it's so cute.
I know.
What are some things, you know, as owners of maybe someone who wants to buy a foal, never had a foal before, what are some things that you would recommend educationally to be on the lookout for?
So, general rule of thumb for me and my practice is to get in that horse's mouth around, 14 to 18 months, because a foal their teeth are soft, so you have to be very delicate with working with them. But they are developing at such a high rate that the way we've domesticated them with the softer forages, the grains, we allow their mouth to develop into sharp enamel points, and the sharp points really affect their well-being. I've had foals on my property that chewed each other's tails off because their mouth was so bothersome.
I have to say, so like listeners know, I have a 10-month-old. We are in the height of teething. Is it the same thing?
Absolutely. Absolutely. So they're trying to find comfort and do what they know how. And also it is noted that horses will chew in excess to create excess saliva, if we have mouth discomforts, or even if we have stomach ulcers. But at 10 months, I can't imagine, but can never say no. So getting in their mouth as early as possible, even if it's just an oral exam and not even performing any reductions or what have you, but getting in there before bitting, extracting wolf teeth if we have them. So then from there, then on out, it's every 6 months recommended, because we're having caps shedding, baby teeth coming off, and those come off at 2.5, 3.5, and 4.5. So typically I like to see my younger patients under the age of 10 every 6 months. And then once we get more of a balanced mouth and we're maintaining pretty consistent general care, we can stretch it out to once a year, unless with the performance horse, we like to see them as often as possible because we want to prevent any like mass blow up or what have you.
Absolutely. That all makes perfect sense. And, you know, historically, my horses have always been, 10 or 8 to 10 when I got them. So It was that lower level of maintenance. But something that I've always wondered about, and I'd love your insight on, at least in my experience, we never had to sedate our horses when the dentist would come out. They enjoyed getting floated. I mean, I'm serious. I could see the smile in their eyes when the dentist was up and they're rasping their teeth away. But in your experience, and I'm not saying for, the one-offs where like we got to sedate this stallion because he's dangerous, but in your experience, do you see that as well? The horses, like it feels good during and after?
I think it's very individual dependent.
Okay.
So I like to have my patients sedated because I want to make sure that I'm doing an efficient, effective, proper job. So my whole practice revolves around balance, right? We want that horse to move so comfortable and be just existing so comfortably that if the horse's head is just too high or moving left or right or what have you, it really affects if I can get my job done well and done within their short little attention span that they allow for the restraint. Because I don't know if the horses that when yours were being worked on, did they have a speculum on?
Yes.
To keep their mouth open?
Yeah.
So some horses don't appreciate the abnormal restraint.
So
even if it's the most well-behaved horse,
sure,
they typically like, "Ooh, I don't know this lady. She's all up in my business and I can't close my mouth." So a mild sedative just to make everything peaceful. I really like working efficient and getting a really balanced job. I very much care about each individual horse. So I want to make sure that everybody is getting 100%, 110% of my effort.
No, and that's a really interesting perspective to hear because, I don't know, sometimes people are just like, no sedation or yes sedation.
I have a lot of that still happen today.
Yeah. And to understand that it really allows you to do your job the best way possible makes so much sense. And I just never really thought about it from your perspective of being, the professional. So thank you for enlightening me.
Absolutely. And it also matters my body position. So the way I was taught in Texas, um, my forearms they need to be in perfect parallel alignment with their molar arcades. So a lot of dentists work up above and they work visually. I have been trained to work more tactile with my fingers, and I like the horse's head directly. The angles are like right parallel with my arms, and I work ambidextrous. So left hand is on their right molar arcade, my right hand is on their left molar arcade, and making sure that we maintain all of that, all of this 30-minute work session. It's nice when they're sedated.
It sounds like you're juggling a lot.
It is. And then add on the questions that come from the owners, which I absolutely love, filling everybody in and working with them or educating them as I'm working. I just think it really helps build a relationship and let them really understand how important this is.
For sure. And we always ask every guest this question at the end. What's your favorite funny story you have with a quarter horse? It could be one you're working on or with Coco.
Okay, this one might be this is truly the funniest one, and this one may be a little bit TMI. Working on the horse, everybody always asks, "Oh, while you're here, can you clean his sheath?" And I'm like, "Yeah, sure, why not? I can show you how to do that. That'd be great." So, and this is the most recent one, and this has topped all of my stories. We go back to this big black quarter horse gelding, and I have no idea why. I have not ventured into the research on this, but his penis was actually an L-shaped backwards. Like when he pees, he pees between his hops. And the owner never noticed it. I was like, you never saw him drop to urinate. No. Nope.
Oh my God. It's not on my bingo card. I gotta tell you
what. It was 100% functional, and we removed the bean as we should. And that's not even a dental story, but I get often asked hey, while you're here.
Listen, folks, I don't know if we should be out here asking our dentists to clean sheaths. If you do, be cool about it. Slip them some extra money. Come on, guys.
PSA.
That is wild. I mean, how old was this gelding?
He was 8. And he was healthy as could be. I've never seen it before, but that has all-time topped everything.
Wow.
Yeah.
That's a good one. That might be the wildest one we've had on the show.
I guess that's more wild than funny, but I was out because I'd never seen that. And I worked in vet med for 13 years, and I've been an equine dental technician for 14 years. So
you've been around the block.
You've seen it all, though. That's for sure.
Never seen it. It was wild.
Well, thank you, Katrina, for taking time out of your very busy day to chat teeth with us today. I certainly learned a lot. Pleasure. And thanks for loving quarter horses and being on the Quarter Horse Podcast.
Absolutely. You guys are wonderful. Thank you so much.
And joining us today is Dr. Randall Raub of Sentinel Horse Feed, who is going to educate us on extruded feed and its benefits for quarter horses, which is exactly the place to be. Thank you so much for joining us today, Dr. Randall. How are you?
I'm good, Ashley. How are you?
We're doing fantastic. And, I'm always excited to talk about everything quarter horse. So thanks for joining us on the Quarter Horse Podcast today. I think what we'll start with, could you explain to us the defining characteristics of extruded feed that set it apart from other feed forms? Let's start by understanding the differences.
Sure. Well, there's several differences in the process of extrusion compared to typical pelleted feed, and I can enumerate those quickly. When we, at least I'm talking about our extruded, Sentinel's extruded product, because they're not all extrusions created equal, just like any other type of feed manufacturing. But you'll tend to grind the ingredients about a third finer than you would for a pelleted feed, and when you do that, you will enhance the digestive efficiencies of those ingredients. You will then cook those ingredients, if you will, at a higher temperature for a longer period of time, and then extrude them under a little greater pressure than what you would for a pelleted feed. And in doing that, again, you enhance the digestibility of those ingredients. And then the feed form itself is a little more puffed up, if you will. It's not as dense as a pellet. So it's much easier to break down both with the chewing and saliva. and it just turns into a mush in a very quick, short order period of time to facilitate swallowing and again to enhance the digestibility of the ingredients. So the basic outcome is you have a feed form that increases the digestibility of the ingredients that you put in that formulation, such that you'll end up feeding 5 to 10% less per head per day, just due to the enhanced digestive efficiencies that extrusion provides.
Fascinating. And that brings up a great point. Quarter horses exhibit a wide range of activity from high performance sports to leisure riding. How does the consistency and digestibility of your extruded feed accommodate these varying energy demands and potential sensitivities within the breed?
Well, like any horse that's doing various activity levels, you're going to adjust your feeding rate, right, to match those energy demands and protein demands of that horse. The harder they work, the more calories and nutrients they need to take in. And so you would adjust the amount of extruded feed you provide like you would any other feed. But that enhanced digestibility certainly provides you to deliver those nutrients in less feed, which leaves more room for the most important component of their diet, that being the forage, the hay, the pasture component. So again, addressing the wide range of uses that quarter horses have, you would adjust it as you would with any feed, depending on their nutritional demands to match up their activity level.
Perfect. And I understand that Sentinel offers specialized extruded formulas for younger horses as well. What makes these products particularly well suited to meet the unique growth and developmental needs of quarter horse foals and yearlings?
Yes, there's a couple of products. The Safe Start that really targets mares and foals, weanlings, and you can carry them out clear up into yearlings and even older. It's formulated that well. Then there's the Grown Excel that can take the yearlings on into 2 and 3 years of age. And those are definitely formulated to provide the greater nutrient density that you'd like to provide to young growing horses, particularly when you look at copper, zinc, and calcium phosphorus ratios to facilitate bone development, and then certainly have the protein, and more importantly, not just the percent protein, but the quality of that protein, which you often define by the amino acid profile. And so we ensure that the correct amino acids and the correct amounts are there, along with the amount of protein. And then, of course, you also have to be conscious of the energy density and the caloric forms. You know, young growing horses do great. Everybody's concerned about developmental orthopedic disease when you start talking about young growing horses. And so if you have the calorie form that is more conducive to growing healthy bone and cartilage tissue, and that is usually a little less starch and sugar in the formulation, and derive more of those calories from a fat and highly digestible fiber source. So those are some of the unique things that you look at and you pay attention to when you're developing formulas, whether it's extruded or any other type of formula for young growing horses, to make sure that the end result is an equine athlete that's got the best chance of long-term soundness, right?
Okay, so I am sold. I want to switch my horse over to Sentinel's extruded feed. Tell me, what are the types of tips or advice you would give to someone who is going to be transitioning their horse off of a typical pelleted feed onto Sentinel's extruded feed?
So it would be the same, Ashley, that I would recommend anybody making a feed change. You do it gradually, right? You take a 5 to 7 day window and gradually change those horses off of what they were feeding to one of our extruded products. And normally I tell them, make it like if you're feeding 4 pounds a day of a typical pelleted feed, go ahead and target that same amount for extrusion. Go ahead and target that 4 pound per head per day feeding rate, transition them over that 5 to 7 day period, and then kind of see where they end up. More than likely, they will notice that their horse is starting to put on some weight, and then they can adjust back if they need to do that. The other thing that's really important, Ashley, about extruded feed when they're making comparisons to a pelleted feed, that extruded feed is not as dense. Therefore, a pound of extruded feed is going to have a greater volume than a pound of pelleted feed. And you know as well as I do, most people, if you ask how much they feed, say, well, I feed 1 or 2 scoops. that doesn't really tell you the amount of pounds. So let's take a typical scoop. If you take a typical scoop of pellets, it's going to be about 3 pounds of pellets in that typical scoop. If you were to use that same scoop and scoop up one of our extruded feeds, because it's not as dense, it's more puffed up for very good reasons, that's only going to be about 2 pounds. So you have to be aware of that you'll look and say, well, geez, it looks like I'm feeding them more. Well, you are by volume, but you're not by weight. And that's a good thing, because then that horse is going to take longer to consume that pound of extruded feed as opposed to that pound of pelleted feed. And for them to slow up their time in consuming that concentrate portion of their diet, that also enhances digestive efficiencies, and that's a good thing. So just remember that a scoop of extruded feed is generally not going to be the same weight as a scoop of pelleted feed, and you just have to be conscious about that as you feed it.
That's a great tip, and it makes perfect sense. I can absolutely understand where you're coming from there. So let's pivot a little bit. Tell me why extruded feed would be a good option, maybe for some of our listeners who have hard keepers versus, the easy quarter horses that we all hope we have.
Right. Yeah, all those horses that get fat on the asphalt and air diet.
Exactly right.
Plenty of them out there. So all the things I've been talking about, enhanced digestive efficiency and improved digestibility of the ingredients that make up the formula, that's a definite benefit for hard keepers. And we see this routinely when we switch a horse off of a typical pelleted or even a textured type feed and move them over to an extruded particle type diet of one of the Sentinel brands. And you will see those horses begin to put weight on, consuming the same pounds of feed that they were previously when they were struggling to put weight on. The difference in improved digestive efficiency is notable, and it really can help with horses that have challenges in maintaining weight. And we have a product in amongst our lineup that offers that more caloric density. It's called Omegatin, and it's a high fat. It's a 20% fat extruded particle again, and that can be used and facilitated as a top dress on whatever they're feeding, but certainly even on top of our extruded particles to really try to help deliver calorie needs to horses that are really struggling. The other thing that always comes to mind, Ashley, when somebody tells me they're having a hard time keeping weight on their horse, I always think about gastric health, right? And could be gastric ulcers, could be other issues about gastric health. And that's something you always have to think about first. If you're having a challenge getting a weight on horses, some of them say, yeah, he's just a hard keeper. Well, he might be a hard keeper because he's got some digestive health issues, and make sure you really address those and investigate those as well.
Absolutely. We have an ongoing joke here at HRN where everything is because of ulcers. No matter what the horse is doing, let's check for ulcers. So, that's a great transition. Given that gut health is crucial for horses of all ages and breeds, what specific digestive issues might be mitigated by using Sentinel's extruded feeds? And what are some of the underlying reasons for those benefits?
Well, you certainly have a greater digestibility, as I said, and that ease of digestibility can facilitate nutrient utilization, even when you have some damaged tissue throughout the gastrointestinal lining. So that's a benefit in and of itself. And we also have a product specific. It's a gastric support product that I think is the best on the market for those horses that are having some GI issues. So it's a Sentinel Care gastric support product. And, it has that buffered calcium that you hear so many people talking about. And that's a good ingredient, and it does help buffer that gastric pH. But it's very transient. When that food leaves the stomach, so does that benefit of that buffered calcium. But in our product, we also wanted to address, how do you use some ingredients that we know are really beneficial to the actual cellular integrity of that gastrointestinal tract. So we have several elements, some different organic acids, a higher concentration of organic zinc, a guaranteed pre and probiotics in this gastric support product. And we know from research that we've done in other species that we have no problem looking at the cellular physiology of those species, translating it over into the horse, that they'll definitely benefit those gastric cells, the enterocytes, the villi, and the squamous cells of the stomach. So if you have a horse that you suspect have gastric ulceration, an extruded product will help facilitate a better nutrient utilization, but you also have to look at a product that's going to help facilitate healing and maintenance of that gastric GI tract.
Absolutely. Well, Dr. Randall, this has been absolutely fascinating. I can't tell you how much I've enjoyed learning more about extruded feed. And for our listeners who want to learn more and try some products yourself, be sure to head over to feedsentinel.com/performance today. Dr. Randall, Raub, thanks again for joining us today.
Thank you, Ashley. Appreciate it.
Feed and supplements? You bet. Vaccines and dewormers? Got 'em. Halters and helmets? In stock. Prescription medications? Yep. And approved by your veterinarian. Your horse's favorite treats and toys? Of course. All these and more ship straight to your barn, fast and free for orders over $49. You can count on Chewy to keep your barn stocked and your horse happy. Start shopping today at chewy.com/equine.
Here's a barn hack you'll wish you knew sooner. You can kill flies before they even hatch. Fly predators are beneficial bugs that prey on fly pupae, killing flies before you ever see them. No more buzzing, biting, or endless stomping and swatting. They don't bother people or animals, but they do keep your barn, pasture, or paddock way more comfortable. Start early and enjoy fewer flies all season. Get yours now at spalding-labs.com.
So now we will be chatting with Doc Yardley. Hi, nice to see you.
Hey, how are you doing?
Doing good. I'm excited to chat with you. So let's just start with, how did you become a veterinarian? Like, what made you want to get into this?
Yeah, that's a great question. So I grew up riding horses. So I grew up a long time ago, and I had a little quarter horse growing up. I'm from Massachusetts originally. So we did, hunt seat and equitation and that kind of stuff growing up. And then, the farm vet always comes out to the farm and you watch them do things. You're like, oh, I think this should be kind of like a cool line of work. So I decided to go to undergrad at Purdue. I was an animal science major. And during that time, I was like, do I really want to be a vet? I don't know. So I actually explored other avenues. I did some landscape management classes. I took a turf science class, which was super fascinating. I looked at like forestry management classes. I was kind of all over the place in my sophomore year because, everyone tells you it's hard to get into vet school and you'll never get in. So I was like, well, maybe I need some backup plans. Mm-hmm. Then my parents were like, what are you doing? Like, just do what you think you want to do. So I was like, okay. So I just kind of buckled down and kept going. And yeah, then I applied to veterinary school and I went to Tufts University and I graduated in 2006 from Tufts, and I did an internship after that in Ocala, Florida. So
very cool.
Yeah.
Wow, that's a lot of schooling.
Yeah.
I thought I wanted to be a vet when I was a freshman in college, and then it didn't work out. But I give vets so much credit because it's a hard job.
Yeah, it's fun. A lot of my friends from undergrads, you have this one big class of intro to vet med or something, and there's 200 kids in the lecture hall, and then it gets whittled down time after time. Organic chemistry comes, and then physics comes, and Calc 2 comes, and soon you're down to 30 of you.
I remember them mentioning that because I was in an intro to animal science class.
Yeah.
And they were like, maybe 40 of you will make it through.
Yeah. And I think people can keep trying, but yeah, it can be hard. It's a grind, and organic chemistry is, I don't really use organic chemistry, but it's the thinking about it is super important. So they have these kind of weed out classes and see if you can get through.
Yeah. So in your daily practice as a vet, how many quarter horses do you see versus like other breeds of horses?
95%.
Okay.
So, yeah. We are in, I work for Ohio State, so I'm in Columbus, Ohio, and I take care of horses about 60 miles, about an hour away from us. And most of the population I work on are Western performance horses, so barrel horses and pole horses, some cutting and reining, is kind of the genre that I've kind of fallen into, which I love. My first 2 years after graduating from vet school, I worked on thoroughbred race horses. So when I was in Ocala, my internship was basically all 2-year-olds that were going to get resold or pinhooked in sales. And then after that, I went down to the Gulfstream Park in Calder and actually Delaware Park and worked on thoroughbreds.
Wow.
And yeah, I thought I was going to be a racetrack vet my whole life. And my wife, or my girlfriend at the time, is a child psychologist. So she needed a job. She finished her postdoc. And yeah, we moved to Columbus, Ohio in 2008. And I just kind of picked up shop and just started doing things there. So yeah.
Wow. So what are the differences you see between working on quarter horses versus thoroughbreds, since you have experience with both?
Yeah, it's interesting. The students asked that question this morning, and I would say in the thoroughbred world, we don't really worry about their feet very much. They're 2 and 3-year-old horses, and we don't take a ton of X-rays. Like, it took me time when I switched back to Ohio, or came to Ohio to take better X-rays of horse feet, because the little quarter horses have a lot of caudal heel pain or navicular syndrome. So I had to really kind of hone my skill set a little differently. The barrel horse and the race horse have very actually similar knee injuries, depending on how fast they run and how they turn. You can see actually pretty similar remodeling of their knee, which is super crazy to think about because the barrel horse is running 14 seconds maybe. I mean, they're training longer, but they're only running 14 seconds, and the quarter horse, the thoroughbred, is racing 6 furlongs. But yeah, you can see some of the same damage in the knee. And the barrel horses bleed. So race horses will bleed. It's called equine-induced pulmonary hemorrhage. Human athletes actually bleed too. So you bleed from your lungs. So if you're just breathing so much air, so some marathon runners will cough up blood because they're like little capillaries and their lungs have exploded. It happens in our horses also. Especially in thoroughbreds, they bleed, and quarter horses do too. And the barrel horse actually bleeds, which I didn't really think was a real thing until I started working on them. And I was like, oh yeah, your horse does have a trickle of blood, which is really you need a lot of time off. We try to catch it with an endoscope. But yeah, so it's interesting. They have a lot of the same, all performance horses are pretty similar, just slightly different variations to that theme.
Yeah. Are there any signs that owners should look for? I mean, obviously, if the horse is coughing up blood or it's coming, that's a pretty obvious sign.
Yeah, that's pretty obvious. Yeah.
But on the other things, is there stuff they should keep an eye out for?
Yeah, I think the clients, the astute riders will say that my horse kind of shut down, finishing, or my horse coughed a little or kind of gagged a little. They'll say some things, and it's hard to know without passing an endoscope, and there's not always vets on site at these competitions. Even at the horse shows are supposed to have vets, but I don't think they're always staffed appropriately. So you can run a scope down them and see. But yeah, if the horse is coughing, it's probably should get scoped. And a lot of times it's associated with equine asthma. So equine asthma is associated with bleeding. So the inflammation of the asthma can lead to bleeding. And then it's a vicious cycle. So once they bleed, the blood is irritating in their lungs, and they get more asthma-like symptoms.
Oh, wow. This is I didn't even know horses can bleed like that when they're so heavy. That's learning a lot today.
Yeah, mostly, not like you. If you're in a hunt seat class, your horse isn't bleeding. They're barely moving. No. But in some of the fast disciplines, it's pretty crazy.
Wow. This is kind of switching gears here, but are there any specific therapies that you recommend on performance horses, or if somebody just has a quarter horse in their backyard? So massage therapy, chiropractic work, acupuncture.
Yeah, so that's a great question. How can I answer this? So I think the biggest thing people can do is keep their horses healthy. So anyone in their backyard, like before you personally, this is me, this is my bias, but before you spend a lot of money on massage or acupuncture or chiropractic, they all have their places. I would want to make sure your horse is vaccinated appropriately for, like West Nile, Triple E, flu rhino, those types of things. Here in Ohio, we vaccinate for botulism a lot. We have a lot of botulism in our hay and in our soil. And then, a good farrier. And then beyond that, maybe you can add some other additional modalities on. But I usually tell people that if your horse is lame and you're doing massage therapy or acupuncture, that's going to help some of the referred pain, but it's not going to probably target, like if your horse has, let's say, navicular syndrome or caudal heel pain, massage isn't, it's going to make the horse's neck feel less tense and their shoulder feel less tense, but you're not changing the pathology in the foot. And that's like where I think you just need a veterinarian's opinion to kind of come in and either medicate it or shockwave or different shoeing and working with the farrier. So that's a lot of the things that we do. Like I'm happy to have like I recommend a veterinary chiropractic acupuncturist in our area. And she does a great job with the horses, but like we have to work as an integrated team because she's working on all the other things and like I'm working on the root cause of the lameness.
Yeah, so we talked about with our other guests too that it's a team effort to keep these horses, especially performance horses, at their best. They're athletes.
Yes, totally. And it's the acupuncture and chiropractic followed up with some massage, like I think really does help these horses feel more comfortable. But if you can only cover it up so much before you have to treat the underlying disease.
Band-Aid on a bullet hole.
Yep, that is very true.
Yes. Okay, well, this is the last question that we ask all of our guests. Can you tell me a funny story of a time you were either working on a quarter horse, one of your own quarter horses? Just what comes to mind if somebody says, tell me a funny story?
Oh, a funny story. Well, I guess the funny story I can think of was when I was a child riding a horse. It's kind of funny. So we were, I was probably like 10 to 12. I don't know. I was a young kid, riding this. Cindy was her name, red mare quarter horse. And, was taking lessons and in the indoor. So it was New England. So I grew up in Massachusetts. So they would, bring the shavings in to the indoor because they didn't have like a facility to hide the shavings from snow. And so we were just like, I think we were cantering around and I kind of like dropped my outside rein and then I had no more steering. And Cindy, being a school horse was like, I'm out of here. Yeah. And we just took off up like this monstrous shavings pile, like to the roof of a huge indoor. And then I fell off, but it was like the best landing ever into like a soft pile of shavings, like there was freshly delivered pine shavings. So that's pretty funny. Like I don't, tell that story often because I don't think about that. But yeah, so that was kind of like growing up. That was kind of a funny moment of falling off where you're like, oh, this wasn't that bad because I've fallen off in much worse conditions. Like horses stopping dirty at a fence and you going over the fence is never fun.
No, I'd rather fall off in a pile of shavings.
Yeah, rather fall off in a pile of shavings. So.